My name is Sadie Carell, and I am the Director of Nursing for Rockland Schools. We currently use Frontline School Health Management in our school health offices. And I would say that this program provides us with consistency in our documentation across the district for our students that we serve, as well as making the processes for running the day-to-day health clinic more efficient so that our school nurses can provide more one-to-one patient care versus their documentation time in the computer system. For individual health care plans, IHP or care plans, we have templates for the normal asthma, seizures, diabetes, and then they go in and it's super easy. They choose the template and then they go in and make it specific to the student. And you can do that IHP in about probably 3 to 4 minutes. Whereas we used to handwrite, and it was great. It would take you all day to write an IHP. The reports that the program gives us is fantastic. It's fantastic in that we can print those reports and go to a principal and say, time out of a classroom is important when you look at data for your school scores, right? I mean, our job is to keep kids in the classroom. And if I have a report showing that this number of kids spends this amount of time out of the classroom, then you need to be aware of that and looking at that when you're looking at your data as a whole for a school. I think the principals that the nurses communicate with about their visits love that I can print a report by grade level, by teacher. It's harder to do that at the secondary level because they change classes. But at the elementary level, I can give a principal a report and they can use it to help with accountability in their building. So I know that principals love those reports. I've handed them out at a principal's meeting before and they're like, oh my gosh, where'd you get this? Like, your nurse can print it for you. So we attend any kind of IEP meeting or 504. So those are kids with some sort of learning disability or some sort of learning diagnosis. Our 504 kids might just have a medical condition that they need accommodations for, or even our kids that are being evaluated for some kind of additional services in the education setting. We attend those meetings. And so it's nice to be able to pull the information from Frontline and to take to the meetings with us. And that is great data to show for the specific student. Hey, look, this is what we're seeing in the health office. I know you guys are seeing this in the classroom. How can we work together to use this data to help this kid? The consistency and the efficiency that it provides can't really be matched. It is that is one thing I am pretty big on, is being efficient and not double documenting, not creating processes that make the job of the school nurse hard. And this makes it pretty seamless. We love HOA, Frontline, School Health Management. It has been wonderful for us. So I can't imagine doing my job now without it.